this is a longitudinal view, sagittal view of the liver. We can see the diaphragm and the heart, and you can angle the probe to see the cranial margin or the cranial liver lobes. They're nice. I'm fine slightly rotating caudally, and I fan to the right, and you can see the cauda vena cava coming into view, and then I fan all the way to the left, the gallbladder coming into view, and then it disappears again. And we got the stomach coming there with the gas shadow. Pointing to the right, and we can see the diaphragm is now orientated horizontally on the screen, and we do the same. We're going to fan cranially to see the cranial liver lobes. We slide a little bit. That's why you have to carry on changing your depth backwards, and you got the gas in the stomach that doesn't allow us to see distally to that. That is normal. You can just about figure it out there. And then you keep it. That's a heart in view. Sorry, but it's also telling you you're in the right place, but you can decrease your depth. And you can see the gallbladder. There it is, a little bit better. In these patients, there is some gallbladder sludge, partially adherent to the gallbladder wall. And you may want to assess that also when she is in dorsal recumbency and then from the other side. There's a small intestinal loop. There you can see better. It's enough, good enough to see on the small intestine the layering quite well. You can see them nicely. That's a nicer picture. That's enough for the kidney. Can you see?
Yeah, beautiful.
That's a good one.
So what do you think you would miss on this machine looking at a kidney? Or do you feel you would see all the major things?
I think on the kidneys you should be able to see, you haven't got much contrast, but you should be able to see the major things you need to see.
Okay.
What you're going to struggle with, but I can see because I know where it is. You got your left adrenal there. The liver is, you're able to identify most of the things there, absolutely fine. Liver is fine, yeah, and intestine. Okay, the liver parenchyma was fine. Gallbladder sludge, you can see it, but not as clear as other machines. Stomach, you can't see the stomach there in enough, but you have an overall impression or can assess the wall thickness. The spleen, you can see it, but you're going to miss subtle changes unless you've got nodules and masses, but it hasn't got enough definition within the parenchyma in terms of the echogenicity. The kidneys is fine, small intestine is fine, the bladder we couldn't check it, the colon, same like the stomach, you can see, but you can't see the layering. Kidneys